All right, good evening. It is March 30th, 9:22 p.m. My name is Miguel Castellanos. I'm a student at TW University at Denton campus. Um, I guess I haven't made a video in a while, so I guess gotta catch you guys up on the few days that's passed. I believe my last video was, oh man, a week. So last week Tuesday. Actually, no, not even last week Tuesday. Yeah, actually, the 25th. So yeah, last week Tuesday. I do apologize about that. I've been trying to get work done and maintain my family structure here at home. But in the last few days, I guess catch up on the news that's been happening. I guess here locally for Denton, the cases of COVID-19, the coronavirus, has been increasing, especially at the Denton State School. They first started off with 11 cases, 11 to 12 cases. Then that actually doubled the next day, and then the following day, Denton County itself had 75 more cases of the COVID-19, the coronavirus. 31 of those cases were at the Denton State School. So what people are seeing is that it is spreading rapidly within our jail systems, in our health, our hospitals, more like the supported living areas, group homes, nursing homes. It's spreading rapidly in those areas since everybody's in tight quarters. There was actually a news article coming from Italy where this nursing home was actually abandoned by its employees, the nursing staff, and unfortunately, all the people that were living there died because all the staff, the nursing staff, were afraid to be in contact of people who were infected. So yeah, that pretty sad news. Um, but like I said, it's just rapidly spreading, rapidly spreading in those areas, our nursing home areas, supported living areas, the state school. Like I said, state school here in Denton, Texas, has it's essentially the hotspot for the COVID-19 virus. I guess expanding out more into more in Texas, the town that we used to live in, Rio Hondo, Texas, they actually had their first confirmed case of the COVID-19 last week. It was, if I can, I want to say it was the police chief for the high school, since the high school has its own police entity. So he contacted, he's pretty much affected by the COVID-19 virus. So he actually infected some other, like some of the essential workers, some of the, I guess you can say the people who work in the cafeteria, who handle the food, the food service personnel there at the high school. He infected one or two of them, and they tested positive. So they essentially shut down all of the drive-through food services there at Rio Hondo. So unfortunately now the families in Rio Hondo, Texas, have to go elsewhere. Essentially, try to branch it out, either in San Benito or in Harlingen. So that puts a little bit more strain on those cities. I guess bringing it back to Denton, we are now officially on a stay in place. Denton officially passed a stay-in-home mandate, essentially stating that we can't be on the roads, unless we have to buy, or we have to get essential items, essentially groceries. Denton is taking it seriously, but not as seriously as they could. Essentially, Denton is, like I said, Denton is on a stay-at-home mandate. They are issuing tickets for people who are past past the curfew. They some businesses are shutting down at a certain time. I believe at 8 o'clock they shut down. 8 or 9 o'clock they close. But I think grocery stores are open at a later time. Um, so yeah, like I said, if are past this curfew, you essentially get a ticket. Whereas I guess going back down to South Texas, they as well are on a stay-at-home mandate. But they're taking a step further that they're putting people in jail essentially. That I don't believe that's a good idea. Essentially, you're just causing more harm to people because one, if there is a person who is infected in the jail system and you're exposing that one person that you just put in jail, you are essentially exposing that one person, and the person leaves, doesn't know they have it, they're spreading it more to other people. So yes, I don't. That's really a unsafe route that South Texas has gone, but it is what it is. Just now, my wife informed me, I guess moving up to present day, for South Texas, some of the counties there in South Texas, you can't even leave the county. You have to have some sort of paperwork, some sort of note, a badge, essentially stating that you're essential, you are an essential worker, and that you can leave the county for work. But if you don't, then you're automatically have to be quarantined. Automatically given a ticket. Thrown in jail, I'm guessing, or escorted back home, and essentially, quarantined for quite a while. That kind of takes resources off the streets, though, if they have to escort you back, or make sure that you are quarantined, because essentially that's one less police officer, or police officers, might be more than one, that are having to make sure that you are quarantined in this. In your home, essentially. So yeah. As far as today, actually going back yesterday was March 29th. So going back yesterday, we did go to the store, to buy some groceries. We had to, essentially get, all the remaining items on our WIC list. The state of Texas opened up WIC, to all items. Before it was selected items, that we could only get from a list on that WIC for groceries. But now the state of Texas opened up that list to all items, so that helped my family and myself dramatically. We were a little low on groceries, but once we got all the remaining items for WIC, it helped us dramatically, and also helped another family, because we did share, some of our groceries with another family that we are very close with. But while at the store, it wasn't busy. There was not very many people at the grocery stores. The grocery stores were bare. Like, there was no pastas, for example. Not very many canned foods. Meats were gone. Dairy products are limited for 2 per family. Like eggs are essentially limited 2 per family, and gallons of milk are limited 2 per family. So yeah, but like I said, there wasn't very many people there. It wasn't as busy as it has been in the past. As well as traffic. Traffic hasn't been very heavy. It's very, very light. Like, you can be driving down the road and maybe pass by, maybe 10, 15 cars, which seems like a lot, but considering the area that we're in, like right down University, it's not very much. You'll probably see more cars in the parking lot of Kroger's or Walmart than you might see on the road. So, traffic has been very, very light. Like I said, the traffic in stores has been very light as well. But while we were at the store, I did notice a lot more people wearing masks, a lot more people wearing gloves or rubber gloves. Just people just trying to be safe. For us, same thing. We didn't want to stay in one area for too long. If we're trying to look for something, we're just gonna skip it and come back to it later. We didn't want to I guess essentially risk that you know risk my family and myself getting essentially sick. So we didn't want to do that. One thing that we did notice that was out were tortillas. Tortillas are out. There's only flour tortillas, which aren't good, or which aren't as good as corn tortillas. So there's a shortage of corn tortillas at Walmart, even at Kroger's too. Um, but yeah, like I said, very late traffic, not very many people shopping. People are taking this seriously. It's it is scary. It is scary. Um, so yeah. Like I said, I guess branching out, I talked to my mother earlier today. She did tell me a little bit what was going on in Ohio. She said that unfortunately for her, she's working. She's still working, but not overtime. She actually works for a manufacturing company that does auto parts supplies. They're in Johnstown, Ohio. So she's working, but essentially she only has herself and maybe four other associates with her, and that's it. She doesn't want anybody else working in that department with her. She is a manager. Hopefully this Friday, I'll be able to get her on here and record her experience and maybe record some of my other family members' experience. I've been trying to get other people to record their experiences wherever they may be. So who knows? Hopefully here soon I'll be able to do that. Hopefully, if people answer me. But like I said, for her experience, like what she was telling me, essentially, she was telling me there in Ohio, the same thing I told you. Like here, the traffic is very light. Not very many people on the roads. Um, for her, since if she has to go anywhere, she essentially she's careful. She writes down on her calendar what time she left, where she went, what time she came back. Essentially, if it's especially for work, goes to work. She's pretty much just sanitizing everything that's in her house, and just takes off all whatever she wore that day, immediately washes it, and takes a shower immediately right afterwards. Um, so that's a little bit of that, but hopefully here soon I'll get more of her input. Hopefully here as well get more of my input from my wife, from her experience when she went to the doctor last Wednesday. So hopefully she can tell us a little bit about that. Um, as far as here on campus is again dead. There's hardly anybody. Maybe I'll see one person walking to the dorms. I can count off maybe 30 to 40 vehicles here in the Lowry Woods area. There's hardly anybody here in Lowry Woods. We've been seeing people move out every day. Even for Gwynn and Stark, we've been seeing people, move out every day, especially on the weekends. There's been quite a few people moving out on the weekends, having their families help them pick them up and essentially take them home. Even for the Gwynn and Stark area, there's probably the same thing, probably like about 40 to 50 vehicles there still. But this is not including international students, so I don't have an exact estimate of, or hopefully here soon, if I can find whoever I can, an exact estimate of how many students are still here on campus, as up to date, essentially. I'm pretty sure it's in the hundreds, whereas before it would have been in the thousands, for that lived here on campus, but it's dwindled dramatically, very very dramatically, especially in the Parliament Village area. There's nobody there. There's hardly anybody there. I could probably count like maybe 10 cars that are there in the Lowry, not the Lowry, the Parliament Village area, the new area. As far as students that I've seen, they've been same thing, taking precaution. They've been wearing masks. They've been wearing gloves. Essentially, just trying to stay safe. Just to keep their distance from other people. Yeah, it's even to get my mail, you can't even to pick up our mail, we have to go to the old student union to pick up our mail. But even that area is restricted for 2 hours. It's only open for 2 hours, and that's it. So we have to make sure that we can get there in the morning from 8 to 10, get our mail, and boom, that's it. But what I noticed though, that there are some people that are hanging out there. I don't know if they're allowed to or what, but I'm guessing I'm guessing not. But they just do to do their work. Maybe a change of scenery instead of their dorm. I've seen a lot of people though study outside too, around the fountain. Well, not a lot, I should say. Maybe like a few here and there that are able to get a space around the fountain area here on campus to study. Essentially change of area. People are going. A lot of people are going stir crazy in their house. So there's also I guess that brings me to another point, that the governor is considering closing all. Well, he's already closed all parks, like with playgrounds. So we can minimize the contact for children. But he's also considering closing all nature trails, walking parks, so that because people are essentially not keeping their distances from other people. So and people are still getting sick that way. So that's something to see, or to look for, to see what happens as that unravels for Texas. There's still, like I said, there's more. Like each day we hear more cases. I believe today there's 11 more cases for the Denton State School. Like I said, they are. It's essentially a breeding ground. Like those areas, like I said, jails, supported living centers, the supported living centers, hospitals, jails are all. It's just a breeding ground because everybody's just in close proximity of each other. So and then we've been seeing reports of people just leaving the job, just quitting, especially from the Denton State School, because they don't want to be in contact with this. They're scared, and that it's you can understand they're scared. If they have a family, they gotta look out for themselves. I remember working for the state of Texas. The state of Texas doesn't really give you that very good insurance. So they're probably seeing it like, man, if I get sick, my insurance might not cover, and like I said as well too, I don't want to risk the safety and health of my family. So it's understandable. But at the same time very sad because these they're people with the people with mental health issues, or who are IDD do need help too, but they don't understand what's going on. So it's very hard to explain to them. And if they've been very close to somebody, a staff member, they're going to be wondering, why is this person gone? Why haven't I seen this person in a long time? So and it does create issues and difficulties for other staff members. So it's I understand. I used to work for the mental health area for quite a bit, so it's hard. As far as job outlooks for people, like I try applying for jobs, but haven't heard anything yet. So hopefully here I can I don't even know where my phone is, send out some emails, just reach out to whoever I apply to, and maybe get an interview. But yeah, jobs are in high demand. There's a lot of warehouses hiring, but there might be thousands of warehouses working, but there's millions of people applying for those jobs because people need money to support their families. And yeah, I'm one of those million people. Other than that, that's pretty much. I guess going back to campus. I guess it's not really, I guess important because it does breed. I guess here on campus, the lawn the grounds haven't really been kept up, so the grass is growing very high. Essentially this whole campus is almost like a breeding ground for mosquitoes. So there's been an increase of mosquitoes here on campus. With those mosquitoes, and they as well too might bring some sort of disease as well too, like last year or a few years back, Zika virus was the big thing too. So we haven't really eradicated Zika virus as well. So it's just something to look out, to look at too, medically wise. So yeah, there's a lot of grass, a lot of bugs out here on campus. But my family and I, we make do with what we can. It's, like I said, essentially, my family and I were one of the few people still here on campus because we have nowhere else to go. And especially with cases in the town that we used to live, we don't want to risk going back and being affected. So that's pretty much it. I wish I had done more, more of these vlogs, but like I said, with family and homework, I kind of fell behind. But I found the time to make this video, for you guys, and hopefully, some of the information you guys can look into, more. So yeah, I do apologize about that, but hopefully tomorrow I'll start, I'll get back on track and start making my videos daily. Start seeing what I can start contacting people, see if I can get them to tell me about how they're experiencing it and whatnot, or how they're experiencing this crisis, essentially, this global crisis. But until then, take care, be safe, and just keep your distance. And until tomorrow.